Article title: What is the cause of my tinnitus? Today, tinnitus is a condition that affects 1 in 5 Americans. It is described as a persistent ringing, humming or buzzing, and for some the condition has a profound effect on the way they live, sleep, and work. There is no known cure for tinnitus, but there is some relief for those who do suffer from this condition. Brief, spontaneous tinnitus can last just seconds to several minutes, is a sensation that many of us have felt sometime in our life. Temporary tinnitus can last several minutes to several hours, and its onset usually comes after an individual is exposed to a noisy environment during a prolonged period of time. Construction workers, rock musicians, or those who attend rock concerts are susceptible to temporary tinnitus. Even a simple fireworks show can find individuals with temporary tinnitus. Those who suffer from chronic tinnitus, the ringing and hissing sound is quite frequent, and chronic tinnitus is defined as occurring for 3 months or longer, representing 5 to 10% of the current United States population, with less than 1% having severe tinnitus. Those that suffer from this condition from all walks of life, occurring in men and women and the young and old. This condition is so prevalent that in the past year nearly 23 million adults experienced tinnitus for 3 months. For those 65 and older, more than 12% of men and 14% of women are affected by tinnitus, and more than 200 drugs are known to cause tinnitus as a side effect when starting them or stopping them, and approximately 16 million people seek medical attention for the tinnitus annually, affecting nearly 50 million people every year. Tinnitus is most commonly found in men, seniors, blue-collar workers, and with certain heart problems. It is not a disease but a symptom of something wrong with your auditory system, but chances are that the worse your hearing is, the worse your tinnitus is. For the elderly, this is usually the first sign in hearing loss. There are many underlying causes of tinnitus, such as age-related hearing loss despite any exposure to intense or loud sounds, ear infections, or ear disease. After age and gender, surveys show that excessive noise exposure is a culprit, bringing on the onset of the condition. Outside of work, the risk for tinnitus is seen on the shooting range, but one of the most important sources for tinnitus or muffled hearing is the constant use of an MP3 player, playing music loudly through an iPhone, or any other activity, that over a prolonged period of time can and will deteriorate your hearing. There is no difference in the how or why you contracted the condition, and, although there is no cure for tinnitus, there is some relief. Whether it's a mild, moderate, extreme, or severe case, there is a 3-step process that is available at tinnitusremedy.com that has helped many individuals overcome their condition and has improved their quality of life. This 3-step process works and will help you sleep better, hear better, and once again be able to concentrate at work once again. There is relief in sight, and we at Tinnitus Remedy will show you how it is done.